health interventions. So this model was created using three digital and public health frameworks: the technology acceptance model, the theory of planned behavior, and the Penn-Tree model. And so the colors that you see on the screen tells us where these factors came from. So the factors in blue I retrieved from the technology acceptance model. The ones in pink are from the technology acceptance model and theory of planned behavior. And those in purple are external variables that I found in the literature. And so when engaging users in DHIs, it's important to understand that they have their own perceptions of the technology. So you can see in the screen the factors at the interpersonal and individual levels. For instance, perceived usefulness. Users may have different interests on how this technology will be useful for them. For instance, we work with parenting interventions. In some regions, parents perceive that this is going to be useful to help keep my teenagers safe or my child safe. In other areas of the world, like Asia, caregivers perceive that this is a great tool to support their children in their educational achievements. And also, for instance, perceived ease of use, how easy they think the technology is to navigate. Hedonic motivation, like the kind of enjoyment they get when using the technology. But also, the individual is within a society which has social norms and may influence their perception of that technology. And so at the community level, for instance, we have factor social influence, and this is the perceptions of their family and peers and neighbors about that technology, for instance, the chatbot, and habit. In our study, we investigated usage habits of WhatsApp, because this is a chatbot technology that was delivered through WhatsApp. So we were like, let's see how, if the familiarity with WhatsApp will boost engagement. And lastly, the individual is within a policy and institutional context that may also influence. For instance, external human support provided by an institution to help troubleshoot any challenge when interacting with the technology, or the provision of marketing materials to make them aware that this technology is available to them. And so in the DHM, the behavioral determinants influence the intentions to use the technology. And this is also a unique feature of DHM, because intention is investigated at a multidimensional level. So I look into intention to use, but also intention to spend money and time, because I acknowledge that when they are using the technology, there is a trade-off. They could have been using this time to do something else. And for instance, in a low-income context, the money spent on the mobile data to use the DHI could have been used to do something else. And then ultimately, positive intentions will then lead to engagement with the technology. And today, I'll be only presenting to investigate how behavioral determinants are associated with intentions. And